My name is Amal Nergadkar. I'm the CEO of Patient Prism, and we are here today to talk about teledentistry. We had an episode yesterday as well, and we're going to talk today to Dr. Maria Kunstadter from the TeleDentists, and have her talk about the teledentistry platform that she's developed over the last few years. I also have my really good friend Teresa Duncan from Odyssey. And all of you guys know Teresa in the industry. She is the world-renowned expert in dental insurance. We're excited to have her because I think there is an interplay of insurance with teledentistry. And so I had Teresa graciously accept my invitation to co-host this interview with Maria. Thank you for joining, both of you, in this difficult time that we're all facing. And I think teledentistry seems to be the way of the future, but the way of now as well. And so I really want to get off my little talk and really ask you right away, what can you do? First of all, what can you do in teledentistry? Not just today, but overall.
Oh, absolutely. Thank you for having me as well. And the world has changed since 10 days ago in terms of insurance, Teresa. So we now have codes that we can file, teledentistry consultations. I've been a dentist practicing for 38 years, and you can do so many patient visits before Corona. We could do BC and after Corona and during Corona that we talked about in terms of a video consultation with your patients. Right now we're getting lots of influx. I'm sitting at home, I'm in pain, I don't know what to do. And that's the response we're getting. I mean, that's what we're responding to largely now, of course, helping people get through this. I can't get into a dentist. I'm swelling. We can prescribe antibiotics, antivirals, magic mouthwash. And then we can also, patients from now are going to have temporary crowns come off, permanent crowns come off, fillings break, all sorts of things that when you have your normal office, you can bring them in, sit them in the chair, palliate them and take care of them. You can do those things on virtual consults, and you can send them to the pharmacy and get temporary filling material, temporary glue material. A dentist can help them figure out if they cracked their temporary crown and it fell, it's in pieces. Only a dentist can address those kinds of issues. I tell all the people we're talking with dentist-wise that if they do clear aligner therapy, they can do video virtual consultations with their patients from home. They can go, how's that aligner fitting? Oh, it looks great. I'm going to mail you your next aligner sets. No need to come in after Corona either. You can really reduce your chair time by doing virtual consultations for many reasons that patients will present with in your chair, because your staff will bring them in after Corona. And then you'll say, oh, you look fine, see you in 2 weeks. And all of those kinds of short-term visits can be handled with a virtual consult. So in pain, go ahead, Almal, I'm sorry, I talk, stop, wave at me.
No, I think it's great because I think a lot of dentists today are only seeing emergencies because some of the states have ordered that.
Right.
What you're telling me is that on a teledentistry platform, they can not only see and triage emergencies and triage people to come in the door, which kind of keeps the lights on and gets revenue, at least on a small basis, right? But you can also see other types of patients with aligners and maybe some other guys that have a chipped tooth or whatever that might be, that are non-emergencies per se, that are prohibited by the state or not recommended by the ADA, but you could still do a consult during this time.
Right, exactly. And let's not forget, because a dentist doesn't think a temporary crown coming off is emergency, but the patient does. Right. So that is definitely not someone you need to have come into the office during your emergency times during Corona. That's somebody you can keep at home. And there are so many things that patients have contacted us about: children bumping their front teeth. It was a 6-year-old and the teeth are now loose. We actually got that call. We can get those kinds of calls. You're fine. No, you don't need to go out and see a dentist. There are so many things that a patient perceives as an emergency that a dentist can palliate, calm the patient. We call it get them off the cliff. make them feel better with some medications and some temporary filling material if need be. So lots of things can be done virtually, especially now, to keep people at home.
And you've got like people even getting like with the stress levels being that a little higher than usual, they're getting blisters, canker sores. It
Yes.
can you help with that as well and diagnose?
Absolutely. And thank you for bringing that up. A diabetic patient called us because she had aphthous before, but she had an ulcer, and being a diabetic at home isolated was really afraid there was an infection starting and wanted all she wanted was reassurance from a dental professional. No, you're right, that's an aphthous lesion. Let me get you some magic mouthwash if it's killing you, and talk her off the take. And you can check, say, do you have swelling under here? I do a lot of visuals with my patients, just like you do when you're in your office, that you can say if it's, swollen ears, neck pain, all the things that you would ask your patient sitting across from them in their chair. But yes, we're getting stress, a lot of viral ulcers from people that are highly stressed. I had a stomatitis patient. Her tongue was all just popped out with stomatitis in her cheeks, and she goes, I can't swallow, I can't eat.
Right.
And the stress is really bringing people a lot of issues that they need help from professionals.
And I imagine that it's a really good way to keep in touch with existing patients too. So it sounds like you're getting calls from the public that wants reassurance. But when this happened, we probably had a lot of cases in flux. We were probably monitoring some patients who we suspected would have issues in the future, maybe had already been on antibiotics. So this is a good way to reach back out to those patients and just do a check during this time. And then afterwards, that may become part of your post-op protocol.
Absolutely. I'm excited. We have a program for offices called My TeleDentists, so they can only their patients will call their URL, or they can personally handle all their own patients for just those reasons. Teresa, absolutely fantastic. And then once I believe that people actually institute this as an urgency crisis therapy, they'll realize how many of these cases they can take 15 minutes in the morning and 15 minutes in the afternoon, see 5 emergency patients, keep them at home and not use chair time for that after we pull through. I remember 9/11, I actually was going to open an additional office at 9/15 of '01. And we can't open a dental office in a time like this. So we delayed it till October 1st, but it was 9 months before the world came back to conscious level of, okay, dental cleanings. And, it took a long time to recover that. Even though it was local, it was still a world crisis. It's even when they say you can go back out, people are going to have been numbed by what's important. And dental offices and those routine cleanings, they're going to drop off. So you need a way to stay in touch with your patients. And one of my favorite quotes is a company that responds to their customers in times of need will be the ones that succeed. And being able to do teledentistry with your patients now is definitely that response.
You talked about the post 9/11, and that wasn't even a health related issue.
Right.
Post COVID, the whole infection control is going to be top of mind. People are going to be a lot more aware of the effects on an already compromised immune system if they weren't already.
Absolutely.
And so I really think it is going to take time for us to bounce back. And it's also going to take time for them to bounce back into a medical setting as well.
Absolutely.
But the other part of it too is the financial aspect, which is many of our patients are going to be stressed financially, but they may not have the insurance they had before because the job has gone bankrupt or, whatever is the situation. So this is a really good way to keep in touch with them without blowing their budget as well.
Absolutely. And we have, not to just profiteer on crisis, because I don't believe in that. We reduced our costs. Our normal direct consumer price is $69. And as soon as this hit, we reduced it to $49 because I think that's workable for most people. Certainly cheaper than going in and knowing they're going to have x-rays and extract all kinds of things. So we are trying to address this crisis in a human fashion, that we want people to know that we're here for them at a fairly reasonable price. And offices that do provide care now they have insurance codes that they can charge insurance. So if your patient of record has the insurances that have stepped up, they can charge for this service, they can charge their patients, or they can offer this as a service because we're healthcare providers across the board to their own patients.
So let's talk about insurance in a little bit. Just I want to kind of go back a little bit and say, you're a doctor today. Your office is shut down mostly, except for handling emergencies. You want to get set up on this platform. What are the steps to take? And what's involved really? You guys do Zoom, and you text. Do people take pictures and FaceTime? What's the process? How is it HIPAA compliant? There's lots of questions around that as well, right?
Perfect. Thanks for asking all that. Before before Corona, you could not use FaceTime and because that's not HIPAA compliant. So just I hazard our platform is a telemedicine platform. It's HIPAA compliant. They check they can read their HIPAA compliant documents on there if they want to. We get consent to do a telehealth consultation, which is very important too. So we have the 2 checks as they enter our system. We have a whole platform where when the patient enters, they fill out a demographic information, medical information that's pertinent to their health, and then dental information. And then again, before Corona, that they could, when they submitted that, that would go to a dentist in their state. Now it's opened up a little bit, that we're trying to keep it state specific, because who knows when they're going to back up on not
Right.
state specific. So we're still trying to do that. And the dentist will be notified that there's a call, and they can pick up the call and do just like we're doing right now. Tell me what's going on. Where does it hurt? Many times they go, "Ah." But as I tell anybody that's a non-dentist, as a dentist, if you're talking to somebody and they say, I've been up all night, it's throbbing, it's killing me, I don't need to see anything. They haven't, it's like, oh, it's, you are a healthcare professional and you know what's going on. If a patient tells me I broke my tooth, I believe them. I don't need to see it. So, but they hold their cell phones up and they show us all kinds of things live in video. So that does happen. And then there's e-prescription on our platform. The patient can select their pharmacy of choice, or if they don't have a pharmacy of choice, by zip code, they have options that they can go to. The prescriptions can be sent to the pharmacies. And then in terms of right now, actually, since you just said that in this conversation, when you are brave enough to open up your office for emergencies, you want real emergencies to come in and be there. So here's your chance to triage the people and say, you don't need to come in. I'm going to take care. You need to come in. That tooth's got to be opened or extracted, but you don't need to come in. I'm going to get you taken care of at home, and we'll monitor, as Teresa said, we'll monitor this until we do open back up, and you will be on our call list for when we do open. But there's so many people that are going to be running into those valuable emergency times in offices that nobody wants to be exposed. Nobody wants to bring a lot of people in, and you can triage patients to your own office.
So if I'm a dentist, is it easy to sign up with you guys? How long does the onboarding take?
Before Corona, right now, we've had like
today, right? I want to sign up today or yesterday.
Today. So we have a My Teledentist program. You'll be sent the information. It is $99 a month for office. We train the doctor and the staff, and of course, the staff and the doctor have all the time in the world. We're doing it as fast as we can, but we're doing WebInEx training right now for groups of dentists, so they can get approved and trained and open it up the next day, pretty much to their own patients. They'll get, Dr. Smith will have a URL that says Dr. Smith Teledentist. He'll send that out, he or she will send that out to all their patients. If you need me, I'm here, click on here. And we can do a virtual consultation. You're trained on how to handle all those, how to go through the system. And then when the patient clicks on to Dr. Smith's, no other dentist will pick it up. It's specifically Dr. Smith's patients. And then they can have all this virtual consultation going on to their own patients.
And the video is within your platform. Is that an app or is it a web-based?
It's web-based, but we call it an app because people are used to dealing with apps. So it runs like an app, but it is web-based, yes.
Right.
And it can be on any equipment you have. Patients use their cell phones to do almost all, 99.9% use their cell phones occasionally, and then on any computer in their office and at home, the docs and the staff can load up the app, at home and be able to take calls from home when they're sitting at home. And again, triage their own patients for who really needs to be seen Thursday when I'm opened up for 2 hours, and get them palliated in the meantime.
So, as far as documentation goes, we can record these visits. And then how is that then entered into the patient chart? Because even
Great
if you're
question.
sitting at home and talking to a patient on your recliner, you still need to document this for, for posterity and to protect yourself. So can you just really quickly walk us through the
Yeah.
documentation part of that? Because that is a question I get all the time. How the heck am I supposed to document this?
Absolutely. So we are, when they enter our system and do the demographic information and the medical information, they have developed a chart. So we actually have a saved in the cloud chart, and we do not video, Teresa and all, because you don't video your interactions with patients in your office. The legal document is the written chart. I mean, that's standard of care. Legal document is the written chart. So when we go into the chart, when we're talking to the patient, it's a SOAP format chart. The patient can upload pictures. You can upload information like patient education information and send back to them. It's a SOAP format, and then the patient instructions that said just like we just send a prescription. Here's your palliative instructions. Everything you wanted to talk to the patient about is, and all that's saved in the cloud and can be reproduced as a PDF to be scanned into the patient's chart of the office. The dental consult occurred. Here's what was prescribed. Here's what was, we call it differential diagnosing, because without a radiograph, you can't diagnose, but you can sure, as a specialist in oral health, you can sure come up with a 99% accurate decision on what's wrong with the patient. And then it's put into the chart, and then you have record for insurance. That this was transpired, and it's whatever the new codes are for teledental consults. You can file with their insurance, and you can put it into the chart, charge their chart for the teledental consult, and have documentation for that entire procedure.
I have a question. I guess it's both for Teresa and Maria. Both is if you're charging a fee
Mhm.
for this consult, let's say it's $50 for a teledentist consult, and
Mhm.
um, do you have to make sure you're not violating any terms with the insurance company that you've said, or is it and then you're billing later on with the insurance company to bill, but what if you've signed with United, let's say, and you're not allowed to really charge based on whatever the plan is.
Well, that goes with any
Getting around
service.
that.
Yeah.
That goes with any service. Teresa, you're the expert. Go ahead and answer that question.
So if you have a contract with a company, it will tell you that you need to submit for all services if you're a participating provider. There really is no restriction on billing the teledentistry or any code. It's a matter of will the benefits come from the contract. So, if you don't know, if you're not sure, you could charge whatever it is that you feel is comfortable to charge. And then the patient would be, responsible for that if the insurance did not cover it. We have received guidance. I have received guidance from a lot of insurance companies that they're going to map it to. So say you reimburse, or I'm sorry, you bill for the 9995, which is the synchronous, meaning real time,
Mhm.
that you would do that along with the 140, which is the limited evaluation. The 9995 is probably not going to be covered at all, but the 140 will be. So many of the carriers have relaxed their in-person requirement for the limited evaluation. So this is, honestly, it's unprecedented, obviously, and the carriers are being flexible in this regard, but there is a cost involved with being a teledentist, and that's why we have this 9995 and 9996 code to, it's almost like a descriptor. It's describing how the method is being done. It's obviously, Maria, you probably know this is not going to be a huge income generator during this time. It's not,
No.
not the goal that it's for, but there is reimbursement if you're looking for it. And the patient also has skin in the game as well. So you could always make sure that the patient is aware of the cost. Actually, you should make sure that the patient is aware, make sure that they're aware of the cost.
And absolutely, three things. Medical insurance has always had descriptors before their procedures, so we're coming into a new world for dental. But no, you're not going to profiteer from teledentistry with your own patients, but you also might not lose those patients after this is over with, because you stay connected with them. And we're all hoping everybody can jump back in and be a productive dental office. But certainly if you let your patients drift away without staying in close contact with them, that's not going to be productive either. So staying in close contact with them and helping them when they need it will really help ensure that when you start again, your practice will have a good footing. And you can schedule those people. You can say, oh, I'll get that filling fixed, and as soon as we're open, you'll be called for the 9 o'clock appointment.
And you're serving, I mean, at the end of the day, it's really not, this is not about the what you're charging. It's really, you're serving a need that exists every single day with existing patients, with society. And part of this COVID epidemic, we want patients to call their dentist and not the ERs.
Right.
Because they're already having capacity issues at the ERs and the hospitals. So it's best to triage this whatever you got on the telemedicine platform. If there is a need, go into the dental office, get it checked out, so you can leave the ERs for people who actually are sick and don't have non-dental needs. I mean, really, we need to do this as it's public service for us not to go to hospitals if we don't need to.
Absolutely. And that is actually how the Teledentist was developed all before Corona, when in 2014, the American Dental Association said 1.7 billion healthcare dollars was spent in emergency rooms on toothache codes alone.
Wow.
That's crazy before Corona, but why would you go in with a toothache and come out with a virus now? I mean, that makes no sense at all. So yes, it's critical now. It's critical after, because we don't need to be spending $1.7 billion on something that shouldn't even go to the emergency room in the first place. They should come to the teledentist.
Do you think too that after all this is said and done, I think dentists will realize like we are sort of behind our medical colleagues in this respect.
Absolutely.
Doing this, and I know for my carrier, my medical carrier, they've been trying to get me to do virtual consults for a long time because it's more cost effective on both ends. Yep. So it's weird for us to think of dentistry being virtual because we got to use our hands and get in there, but there's a lot of aspects that I think once you start using it, you're going to see how valuable of a tool it is. Not just triage, but follow up. And then the Invisalign or the clear aligner checks, that's, I mean, how much time do you waste? And also disposables and all of that. So I just think that if you see this as a short term, you're going to fulfill those goals for yourself. But I think if you think of it as a long-term solution to reaching your patients, those are the dentists who are going to really see the true value of this new modality.
Absolutely. So telemedicine's been around for 24 years. And I would love to come on when things have calmed down and talk about how to maximize your practice with teledentistry non-corona times, because that's how we started and to address people not going to emergency rooms, et cetera, but maximize your productivity in your offices by doing the same thing you're doing during corona, only keeping patients at home because they don't need to come in, as for all the reasons you just said. So I got into this believing all of that. Then corona hit. We're now a household word. Study recently showed that, and not our study, showed that 78% of patients assume they will be doing before corona, that they will engage in a teledental consultation in the next 2 to 3 years. Now that's probably been crunched down a lot. And so the customers, the patients are willing to do the consultations. The only guiding line to that entire research, which I'll send to you all, was they didn't know where to make contact with the teledentist, and we're obviously changing that picture now. But patients are ready, and dentists need to be ready, and the industry needs to be ready to provide this kind of care. And one of my favorites, since we're all healthcare providers, is even telemedicine doctors will come up and go, well, now how do you do teledentistry? And my answer, this is our joke of the day, my answer to that always is, well, now look over there at all the things your company says they offer. They offer ear infections, coughs, urinary tract infections, and I'll look at them and go, now you treat UTIs, but you don't get all up in there to treat that now, do you? And they literally still blush most of the time. No. And I said, well, we don't need to get in the mouth all the time to treat dental problems. And they go, okay, I get it. So there's my thought for the day.
Let me ask you a question that kind of has two components to it. Right now, a lot of dental practices are facing some layoff situations, especially with hygienists, right?
Right.
And obviously, your team is, your life. I mean, without your team, you can't practice dentistry. You retain a team. You've got great people, great hygienists who genuinely are great clinicians who care for their patients. Now, what kind of role hygienists have in this process? Is there a role for them?
Actually, yes, we are signing a contract with HealthPlex in New York, and it's a huge dental provider. And that is going to be a screening process that the hygienists are going to be doing the screening in patients' homes. As you probably know, 40% of children that have Medicaid don't ever get to use their dental services. They just never get there.
40%.
So we're trying to touch those parents in their home on their cell phone and screen and educate the parents. You know, a lot of parents don't even know they're supposed to brush baby teeth. I mean, there's so much unknown information in oral health. So we are ramping up what we call it the Teledentist Education Center, and the hygienists are going to be staffing that exclusively. And if it ends up being you need to talk to a dentist, we can connect them to a dentist. But the screening code, Teresa, in HealthPlex allows at-home screening, and we'll be able to look at the child's teeth. And if not, we will show parents how to brush children's teeth. Sometimes it's a headlock. I mean, all the things that parents don't know. And we hope to be able to really reduce that 40% that haven't been contacted or haven't been to an office. Educate, and tell them they need to get into their assigned doctor after all this is over with for routine care. Again, still that, well, their baby teeth, they don't need to be taken care of. I mean, there's still a lot of misinformation and lack of knowledge in oral health, and the hygienist will be that key player in our teledental education center.
And if that information is then sent to a doctor, that's that second type of teledentistry that we see in the coding. That's the asynchronous. So it's not a real time that the doctor is there to make the evaluation. The information would be sent to them later. And then so you would have the coding for the screening, which is it's in the diagnostic section.
Right.
So you would have the screening code and then the collection of the data, and then it could be sent over for the evaluation code. And depending on, Medicaid does cover the screenings. Most of the state Medicaids do. And I believe they're looking to expand that to the teledentistry codes, which are relatively new to most dental providers. So there's a lot of different ways to utilize not just the real-time synchronous, but the asynchronous as well. And exactly. I know that's really how I got started with understanding all of this, was because of the referring back and forth between specialists and general dentists. And that's asynchronous teledentistry.
So our director of operations, Leah Sigler, is a hygienist. And she trains all the My Teledentist staff and doctors on how to provide this care for their patients. And yeah, I mean, we can include part of an education site for their hygienists to stay involved in, monitoring and helping people stay healthy during these times, so the hygienist can be on board. Again, they could even offer a Zoom for their patients on our platform and get like 6 to 10 patients all about, home care issues during this crisis, and don't forget to floss and those types of things. So, and then again, our bigger picture, like we're in negotiations with Cigna and Delta and all kinds of big companies to provide our services. So we will be hiring hygienists as well soon, and Leah already gets a lot of hygienists saying, what can I do? And that's an excellent, we're trying to, HealthPlex was extremely innovative to set up this plan, and we're really excited. That starts June 1 for HealthPlex, and then we're also putting on a coronavirus contact site for their other customers as well.
Well, this is a lot of information, and it's a lot to process. I think, I think Medicaid is going to be a big issue too if you have Medicaid, because Medicaid is going to pay, I believe. I don't know what the rules are, and depending by state, Medicaid is going to pay for this, and this could be a big opportunity, especially during this time.
Yes,
to build
absolutely.
Medicaid for this consult, and you could potentially advertise. Use some sort of advertising to reach out to the not only existing patients but new patients that could be on Medicaid, that they don't even know that they're covered by Medicaid. and
Mhm.
you get paid.
Part of our My Teledentist package includes a press kit that has a press release that they can, let the community know, and that they are offering teledental services to their patients. And also they can give their, their URL that if somebody in the community that's not a patient needs them, they can contact them as well. So it is big to be state of the art and offer care for people in times of need.
This has been a fantastic conversation. Thank you, Maria, and thank you, Teresa. The information to contact both of you ladies is on the screen. Please contact them whenever you feel is appropriate. Good luck to you guys, and we'll talk soon.
Everybody be safe, and thank you for having us, and we will see this on the other side. Look forward to working with you then too.